What if you found out today that you had an inoperable brain tumor? You would undergo treatment like chemotherapy or radiation. You would try different surgeries to get rid of the cancer in your body. But what if after trying all of these things, the cancer is worse and you now only have a few precious months to live? How would you want to spend those last moments? Death with dignity laws provide patients, like I described, a way to die peacefully and comfortably on their own terms. These laws will provide us all with that option. I'm going to discuss the reasons why this law should be enacted in Oklahoma as well as other states. There are two I'm going to discuss today. First, I will share two stories of people that use this law to die peacefully when they want it. And secondly, I will explain the provisions in place to protect these patients from the common fear of coercion. Terminally ill patients deserve to die in peace, free of pain and unnecessary suffering. The most popular story is about a woman named Brittany Maynard. This is her pictured here. After finding out that she had an aggressive tumor, Brittany underwent surgery and treatment to try and rid herself of this cancer. Just a few short months later, however, she found out that not only had the cancer come back more aggressive than before, she now only had 6 short months to live. Brittany Maynard describes in her 2014 article, My Right to Death with Dignity at 29, to CNN, that even though her body is physically healthy, the cancer is eating her brain away. She could suffer with horrible pain in hospice for potentially months, and she did not want that. So she and her family decided that they would move to Oregon, where there was a Death with Dignity Act. She finally met the requirements and got her dose of lethal medication. She stated it was a tremendous sense of relief just having the medicine. On November 1st, 2014, after having a horrible seizure, she decided enough was enough. She took the medications in her own home with her family around. Her husband states that she was very happy. She fell asleep within 5 minutes, and within 30 minutes, she had passed away very peacefully. This also happens in other countries. Mars Kramer and his wife lived in the Netherlands. Mrs. Kramer was a longtime supporter of death with dignity laws in their country. They legalized it there in 2001. And after being diagnosed with a rare bone marrow cancer, Mrs. Kramer followed the protocol of treatment, chemotherapy, surgeries, radiation. Mars Kramer states in his 2015 article titled Euthanasia Respects Individual Autonomy and Requires Deliberation that his wife's cancer turned aggressive and treatment no longer worked. The disease took all of her white blood cells that would protect against infections like the common cold and the flu. Mrs. Kramer decided to voluntarily take her own life peacefully with medication. She passed away at the end very peacefully with all of her family around. Some people worry that making this law will cause coercion of patients by doctors or family members. However, there are provisions in this law that will protect these patients. In states where the law is enacted, there's a long list of requirements patients have to meet. When a patient comes to a doctor and asks for this option, the doctor will first evaluate the patient's mental competence by a psychiatry exam. They will also evaluate physical, mental, social, and spiritual suffering. The doctor will then visit all other options of hospice care and the like again with the patient. Helen Starks wrote in a 2013 article titled Physician Aid in Dying, Ethical Topic and Medication that if the patient persists, there are more requirements to be met. She writes in this article in terms of Washington's Death with Dignity Act. She states numerous requirements, and among them, the patient has to be 18, a legal resident. They have to be competent, which is measured by referrals to other physicians and psychiatrists that have never seen their medical records. Their death has to be imminent, which means they have less than 6 months to live. The patient will then meet with other counselors and other physicians again to make sure that they are not being coerced by family members and that their decision is theirs alone. Only after passing all of the 15 or more requirements can a doctor prescribe the lethal dose. In Oregon, the request has to be signed by 2 other witnesses, one being completely unrelated to the patient and completely unrelated to their medical care. And patients have to wait 15 days to receive the medication. All during this time, up until they decide to take the lethal dose, they can always change their mind. At any point in time, they can change their mind. Many also worry about certain minority types being forced into this option, such as racial and social minorities, as well as the elderly and mentally ill. However, Dan Gardner wrote in his 2011 article titled, "There is no evidence that legalizing euthanasia will result in a slippery slope," that a study done by Dutch scientists in 2009 showed no evidence for a higher frequency of euthanasia among the elderly, people with low educational status, the poor, physically disabled or chronically ill, minors, psychiatric patients, or racial and ethnic minorities. There is also evidence to show which illnesses cause the biggest use of this law. Unsurprisingly, malignant tumors is the biggest reason. In this graph, taken from a Time article written by Josh Sanborn in 2014 titled, "Brittany Maynard Could Revive the Stalled Death with Dignity Movement," shows that other debilitating illnesses like ALS and AIDS have decided to use this end-of-life option. Dan Gardner also showed evidence in his article that these laws have helped to prevent underground illegal euthanasia from happening. There are currently 5 states that have this law: Oregon, Washington, Vermont, New Mexico, and most recently California, thanks to Brittany Maynard and her efforts. Montana decided in a court ruling that their doctors would be protected if they decided to help patients, but there is no law that states that they can use that option. These laws have helped patients die peacefully and prevented illegal euthanasia by the provisions and monitoring in place. Terminally ill patients have a right to die peacefully when they want instead of suffering for no reason. Death is imminent for them. I encourage you to go to Compassion and Choices website, www.compassionandchoices.org, or thebrittanyfund.org, where you can either donate money or they will help to submit a letter to our state representatives. There was a bill in Oklahoma presented in January 2015 called the Death with Dignity Act, but never made it out. It was never even voted on. Let's push state legislators to get this bill back on the table and pass so our families can have this option if they need it, to die pain-free and with dignity.